My main specialty as a researcher is cultural sociology, which is how people think about the world and about themselves, and how that's different in different places and in different times. And the research project that I focused on most in my career to date is a comparison between the US and the Netherlands that looks at how adolescent sexuality is dealt with differently in those two countries. You wouldn't expect it because they're very similar countries in a lot of ways, but the way in which teen sexuality is viewed in the family, in policy, in schools is very different. Teen pregnancy is one of the highest in the US versus the Netherlands, where it's one of the lowest. Teen sexuality leads to a lot of conflicts in the US within the family, and then in the Netherlands it is more openly discussed and so forth. So in my book, which is called Not Under My Roof, Parents, Teens, and the Culture of Sex, I compare especially how teen sexuality is handled in the two countries. In the family, in the Netherlands, when young people can talk more openly with their parents, with educators, with healthcare providers, they are able to receive more support and able to plan for sexual activities, use contraception, prevent STDs, and so forth. And they get more support for the relationships they form as well. So you can see very clearly kind of the connection between that research and the impact on society. I've worked with doctors to take some of the implications of the work and see what kind of recommendations to make for how healthcare providers interact with young people. I've also worked with colleagues in other fields to talk about what are some of the implications of my research and other existing research for sex education policy and adolescent sexual and reproductive health policy more generally.